Hey, it's Traylon, nurse practitioner, Victorious Wellness Center, the Houston and the Wall location. So today we are going to talk about breast health. So we know that October is Breast Cancer Awareness Month, but I want to make sure that everyone is aware of their breast health every day of the year, not just in October as well. So a lot of times when I'll have women come in and schedule an appointment for their Well Woman exam, I'll ask them, do you perform self-breast exams on yourself? And a lot of times most women tell me no, they don't, just because they may be unsure of how to do it, or they just don't really think to do it, or some people don't want to know. We have people who don't want to know either. So self-breast exams, I want to talk about it a little bit today because it is important that you are performing a self-breast exam on yourself every month. Because as your healthcare provider, we're only performing a breast exam on you once a year unless you have some symptoms or something that arises that, breast exam needs to be performed sooner than that. So you would be the one to know if there was any changes going on with your breast sooner than your healthcare provider would if they're only performing the breast exam once a year. So I do tell women you don't want to perform your breast exam at least a week prior to your menstrual cycle if you are still experiencing menstrual cycles, because there could be some tenderness, there could be some lumps and things like that that are just related to like hormones, because your body's preparing to experience a menstrual cycle. So you want to wait until after your menstrual cycle is has completed. Men also do need to do breast exams. It could be done at any time of the month. You just want to make sure that you are performing them. So for a breast exam, I tell women and men just to make sure that you are performing the breast exam. Usually it's easier when you're taking like a shower, a bath, whichever you like to take, just because you have soap and things on your breast. It makes your fingers glide a little easier so that you can just keep sliding them around to keep checking your breast. So you want to put your arm above your head for both sides, do one breast and do the other. You want to start at the nipple area and walk your fingers around. You always do want to examine your nipple as well too, because there could be changes to your nipple and it's signaling that something is going on, with your breast. So if your nipple ever changes, so before, it's outward and now all of a sudden it's going inward, nipple discharge, things like that, you want to monitor as well too. So like I said, you want to start with the nipple area and you want to walk your fingers around the breast, the entire breast. So you don't want to do these big old circles. You want to go each area of the breast and walk your fingers around, and you're feeling for any lumps, bumps, things like that, things that weren't there the month prior when you did your breast exam. All of that is important. And you also do want to walk your fingers to your underarm as well too, because there could be lumps or bumps in your underarm that are signaling that something is going on with your breast as well too. So you want to make sure that you are doing that once a month, like I said, not the week prior to your menstrual cycle starting, but you want to make sure that you are performing your breast exams. If it is time for you to have a mammogram and you are at that age of 40, then you also need to, schedule your breast exam with your provider and then also receive an order for a mammogram as well too, so that they can do imaging of your breast just to check for breast cancer as well. So what are some other things you can do to help, prevent breast cancer? You can make sure that you are within a normal body weight. You can exercise as well too. That will help. And you also want to make sure that you are not smoking tobacco, because that can increase your risk as well. If you have any family history of breast cancer, that's important for your provider to know, because you may receive imaging at an earlier age because you have a strong family history of breast cancer. And there are also some calculations that can be calculated just to see like your risk of breast cancer, your 5-year risk and lifetime risk and things like that. So like I did say, breast cancer does not only affect women, it can affect men as well too. So men, you need to make sure that you are, examining your chest area, making sure any lumps, bumps, any changes with your nipple, skin changes, women and men, rashes, things like that you're noticing, redness. All of those are important and related to your breast health. So I hope this information was helpful to somebody. We do perform Well Woman exams, physical exams at the clinic, Houston and Waller locations. We accept multiple insurances. Usually with your insurance, Well Woman exams are covered, usually, but we can always double check your insurance just to make sure. Physical exams usually once a year are covered. as well, mammograms, things like that. But we can check with your insurance just to make sure that, that information is true and you wouldn't owe anything, or if you did owe something, what that cost would be. But we do perform these exams at our clinic, the Houston and the Waller location. So make sure that you are receiving your annual breast exam and that you are performing your monthly breast exams on yourself as well too, because like I said, you would know sooner that something is going on with your breast than your healthcare provider. But if you do feel something, you do need to schedule an appointment with your healthcare provider. So a breast exam can be performed, diagnostic breast imaging, mammograms, ultrasounds, things like that can be performed. So I hope this was helpful for somebody. Again, Victorious Wellness Center. You can always visit us on social media, on the website, call to make an appointment, or you can schedule an appointment online as well too. And I hope y'all have a great and healthy day.